Hello everyone, greetings from American Oncology Institute Facebook Live session. Today's session will be on bone marrow transplant in children. And to discuss this, we have with us our consultant Pediatric Hemato Oncologist plus bone marrow transplant physician Dr. Ranjith Kumar. Good afternoon doctor and welcome to our Facebook Live session. So before we start, I request you to give a glimpse about your area of expertise.
Namaste all. Myself, Dr. Ranjith Kumar. I'm a consultant hemato oncologist and bone marrow transplant physician at American Oncology Institute. And so the area of expertise from my side, I do like predominantly the pediatric hemato oncology program and also like bone marrow transplants for the various disorders, includes like thalassemia, sickle cell anemia, hereditary pancytopenias like Fanconi anemia, aplastic anemias, and also blood cancers also we treat, and other pediatric solid tumors like liver cancers of the children, kidney cancers of the children, bone cancers of the children, and also brain tumors also we treat in our center.
So moving on with the session, sir, what is BMT in children?
Yeah. So, Vijay, you have asked the right question. The bone marrow transplantation, we also call it as a stem cell transplantation. Basically, the bone marrow transplantation, everybody will think it is a kind of surgery, major surgery, but it is a myth. That is the first thing all the viewers should know that. So, bone marrow transplantation is one of the simple kind of procedure where the bone marrow cells or stem cells will be taken from a donor, either it could be a relative donor or unrelated donor. And so we basically bone marrow transplantation is basically changing the diseased or non-functioning bone marrow of a patient with a healthy stem cells from a other donor, means like other human beings. So that is a bone marrow transplantation basically.
So the next question, doctor, is it possible to do BMT in children of all ages?
Yeah. So BMT can be done in the children's and also adults. Our center is well equipped to handle all kind of children's for the bone marrow transplantation. So in our center, we have done the youngest transplant is the 5 months baby, and the oldest we have done up to the 60 years of old. So transplantation in the children's is well possible. So we can do from the 3 months of age to until 18 years of the age.
So the next question is, doctor, what is the minimum age for bone marrow transplant?
So at our center so far we have done the minimum age of the child was the 5 months, but we can handle as low as the 3 months children's, because less than 3 months nobody has been tried, and the 3 months is the probably like the lowest age where we can actually contemplate the bone marrow transplantation for some of the conditions like by birth some of the children will not have a immunity. So those are called as severe immunity deficiency. So those children we have to contemplate the transplants as early as possible, because they are at very high risk of the mortality because of the low immunity and due to the recurrent infections.
So my next question would be, sir, is BMT a high risk procedure?
Probably it is partially, it is a kind of like a little risky procedure. So what we usually do is, see, now the availability of the technology and the medicines and availability of the other interdepartmental multidisciplinary approach. So I feel like the transplant is doing in the transplant in a safer manner with a good team is extremely important. So if you have a very good team of the transplant physicians, the transplant nursing people, and also like allied specialty people, if you are having in a center, I don't think it is a very risky procedure. Only thing is you need to handle those small kids for any complications. So that is the reason you need to have the well-trained the nursing staff and also the well-trained the other systems to be placed in a center to conduct the program. And with the kind of the good team, I don't think it is a risky procedure. It is a kind of any other blood cancers what we treat. The same kind of the way bone marrow transplants also will happen.
Moving on with the next question, doctor, what is the success rate of BMT in children?
Yeah, so it's a very important question because any family member who is coming basically with their kids, the first thing they'll ask, what is the success rate for my kid? So normally we in oncology, what we usually say the success rate means, we cannot say for a particular child the success rate. Normally it will happen like based upon the studies which they have done. So we always tell the success rate based upon the 100 people. So in children's, normally if you see the compared to the adults, the success rates are extremely high. Let's say for example, like if you see the Western data and also like our own Indian data, nearly 60 to 80% of the pediatric cancers are those are requiring the bone marrow transplantation are curable. So nearly 60 to 80% of the children will get curative treatment with the bone marrow transplantation.
What are the different steps involved in the BMT procedure?
So the broadly first what we need to know about the bone marrow transplantation. Basically we have two categories of the bone marrow transplantation. One is autologous bone marrow transplantation. The second one is the allogenic bone marrow transplantation. Autologous bone marrow transplantation commonly being done in a conditions like lymphoma or neuroblastoma like conditions in the children. So here in the autologous stem cell transplantation, the patient himself is a donor. Whereas in the allogenic stem cell transplantation, other family members are like in a blood bank, how we purchase the blood, we can purchase the stem cells from a registry. So it is an unrelated donor. He is not a family member, but we can also purchase stem cells. So broadly, actually, transplants are two types. One is autologous bone marrow transplantation and allogenic bone marrow transplantation. Then the next thing is the steps if you see in the bone marrow transplantation. So initially what we do is in the bone marrow transplantation, we have to clear the bone marrow cells of the recipient. Means whoever is the patient is there, then bone marrow already having enough amount of the cells. So we need either it could be a normal cells or abnormal cells. So in the normal cells means it may not be functioning well, like kind of immunodeficiency or in some of the conditions where bone marrow is not functioning well. So we have to clear up all the cells which are already present in the recipient. So for that purpose, what we need to do is we need to give the chemotherapy initially. So that chemotherapy we call it as a conditioning chemotherapy. So following that is one of the major step in the bone marrow transplantation. Following the conditioning chemotherapy, we do the stem cells infusion. So we will collect the stem cells from the donor and then we will reinfuse like a blood transfusion to the recipient or patient. So that is the second major step. So after these two steps, the third step is going to be keeping the patient in a neutropenic period in a safe environment, because all these bone marrow transplant rooms are well equipped with the HEPA filters. Means basically they are at the low immunity, so we need to protect them from the infections. So that's why they have to be under the observation for about 2 to 3 weeks to basically manage the neutropenia period. So during this phase, patient may develop the fever, so we need to start the antibiotics. So this is the third step. The fourth step is the counts, means like WBC count, the red blood cell count and platelet count will start increasing by the end of the second week or the middle part of the second week. The count starts really increasing. So that is the fourth step, we call it as engraftment. Then in the case of autologous stem cell transplantation, we will be discharging the patients following the engraftment. Even in the allogenic stem cell transplant also will be discharging, but we will keep them under the close monitoring because the post-transplantation issues are little higher in the allogenic stem cell transplantation compared to that of the autologous stem cell transplantation. So basically, if you divide the transplant into the four steps, one is the conditioning therapy time, second thing is stem cell transplant infusion, and third thing is the post-transplant and neutropenic period, keeping means managing them for the infections or like some of the conditions like a veno-occlusive disease or like lung infections or bleeding problems. So those things we will be treating in the third phase. The fourth phase is going to be the engraftment phase, nothing but recovery of their counts. So these are the four common steps in a bone marrow transplantation.
So doctor, after a successful BMT procedure, how does the child recover?
Yeah. So usually, as I told you, like in the last question, we have 4 steps. So once the counts are recovered, means their WBC count is normalized, their platelet count is more than 1 lakh, their hemoglobin is more than 8 grams per deciliter, we usually discharge them from the hospitals. So they will be under the follow-up. And they usually will be compared to the other children, they will be still having some amount of the low immunity. So they are at prone for the infection risk. That's why we usually tell them not to go to the crowded places, to keep them at the protected environment for at least like 6 months post transplantation, particularly in the case of allogenic stem cell transplantation.
What if the child develops complications after BMT?
Yeah. So the most important thing is what we need to keep in mind when you are actually contemplating the bone marrow transplantation. What is the chances of the risk we need to know. So we need to explain to the family before taking up the patient for the transplantation. So the complications, most of the complications, for example, like 80 to 90% of the complications are manageable complications. Of course, these are the major procedures. So some of the children also might have a life-related events also during the kind of the transplant. So the major risk is some of the infections are the major risk. The bleeding is the major risk. In case of allogenic stem cell transplantation, particularly if you are actually contemplating for the high-risk underlying conditions like thalassemia, sickle cell anemia, and some of the osteopetrosis, and some of the children, they received a lot of blood transfusions in previously. So they are at the high risk of the complications. So those children's a condition called as veno-occlusive disease is one of the little high risk, means adverse events. So they're almost at least like 10 to 50% of the children may also have a life related events. So these are the common complications during the bone marrow transplantation.
Doctor, after the BMT procedure, can a child lead a normal life?
Yes, of course. So unlike the other transplants like the kidney transplant, liver transplant, bone marrow transplantation, most of the times we usually stop all the medications by the end of the 6 or 9 months, maximum by the 1 year. So at the end of the 1 year, most of the successfully performed transplant children, they will live as that of the other normal kid. So it is quite possible for following the bone marrow transplantation, child will have a normal livelihood compared to that of the other siblings or other family members.
So coming to the final question of this session, sir, what are the benefits with BMT treatment in children?
Yeah. So the benefits of the BMT treatment varies depending upon the underlying condition. For example, BMT we will do for a blood cancer children. So where actually we want to cure the underlying blood cancers following the chemotherapy. So that is one indication. That is one actual benefit. So we are going to cure the underlying cancer. So that is one of the benefit. The second benefit is some of the children by birth they have a very low immunity. So their immune system is not capable enough to fight for the infections. They are not able to produce a good amount of the antibodies. So there what we are actually by doing the bone marrow transplantation, we are basically replacing the old or non-functioning immunity of a kid with a new cells, where those actually new cells from a good healthy donor will function for them against the infections and also produce the good immunity. So this is another second benefit, means those children who are actually born with the immune deficiency, we can actually cure the immune deficiency. That is the second benefit. The third benefit is, for example, a child might be receiving a regular transfusions because of the thalassemia or sickle cell anemia. So if at all if you are not contemplating the bone marrow transplantation, lifelong they have to take the blood transfusion. But there are a lot of issues with the blood transfusion, because once if you are actually starting the blood transfusion, they also have the risk of the iron overload, because each blood bag will have a lot of amount of the iron. At least minimum of each bag will have around 250 milligrams of iron will be there. So that complete iron will be deposited into the body. So if the child is keep on taking the blood transfusions years together, always there is a chances of damaging of the liver and also heart and other organs because of the iron overload. So at this point of time, for the thalassemia and sickle cell anemia, the only curative treatment or approved treatment is the bone marrow transplantation. This is the fourth benefit. The fifth benefit is some of the children, though they actually born normally, over the years they may develop the aplastic anemia. Aplastic anemia means their bone marrow is not functioning well. And then what we need to do is, in that condition also, the only curative treatment is the bone marrow transplantation. So broadly if you see the benefits of the bone marrow transplantation, basically we are actually treating the underlying condition, or we are curing the underlying condition so that they will have a normal lifespan.
Finally, doctor, overall on this topic, what would you tell our viewers on this?
So one most important point which I would like to tell to the viewers, the bone marrow transplantation in a well-trained physicians and well-trained nursing staff, it is one of the safer procedure. And the centers like us, we almost does nearly like 30 to 40 pediatric transplants in a year, and this is one of the good number of the transplant we do. So timely referral by the referring physicians, and even the parents of the child, like for example, like they have to go for a good referral, kind of like a second opinions, to take second opinions about a condition where actually like bone marrow transplant, if at all required, it has to be done. And the bone marrow transplantation in some of the conditions has to be conducted in an emergency manner. So wasting of the time is one of the extremely the dangerous thing, because some of the underlying conditions will have a life-threatening infections. So hence I would request all the viewers, whenever actually like if you are having a child requiring the bone marrow transplantation, early referral to a physician or team where actually like, or hospital where they can conduct in a safe manner, in good conditions, means like the good by the good team, so that the child will have a like good future.
Okay. Thank you, doctor, for such an informative information. Thank you all for being with us and watching this informative session. And I thank the doctor for providing the valuable feedback. Thank you.
Thank you, Vijay.